What if some of the most powerful healing agents, the things that actually make us feel better, aren't what we typically imagine?
Hmm.
We often hear the word placebo, right? And, well, our minds immediately jump to that image of a harmless sugar pill.
The inert substance, yeah.
Exactly. Maybe something given when there's uh, nothing else to be done, or maybe even as a kind of benevolent trick.
Hmm.
But what if that seemingly simple concept, the sugar pill, is actually far more complex, far more significant?
And way more pervasive in the entire landscape of healing than we've ever really acknowledged.
Right. What if it's not just some footnote in medicine, but maybe a fundamental, often misunderstood pillar?
It's a concept that doesn't just challenge our understanding of what a pill can do. It genuinely pushes us, I think, to reevaluate the very foundations of how we understand medicine itself.
And the human body.
And the human body, and that intricate dance between our minds and our physical well-being. It really asks us to look beyond just the chemical compound in the pill.
That's such a crucial distinction. Today, we're embarking on a deep dive into precisely this, the placebo effect.
We are.
We're going to journey through its surprising and honestly truly ancient history. Then we'll try to peel back the layers to examine the cutting-edge science, or sometimes maybe the surprising lack of science behind how it actually works.
And explore its undeniable, though often hidden, influence across virtually every corner of medicine. We're talking diagnostics, treatment.
Even surgery, as we'll see.
Even surgery, exactly. And yes, we'll even grapple with the fascinating and sometimes pretty uncomfortable ethical dilemmas it presents for doctors and patients alike.
It's a concept that really touches on everything, doesn't it?
Yeah.
Human psychology, neurobiology.
Even the economics of healthcare, yeah.
Now, to guide us on this journey, we've really leaned into a fascinating and, I think, foundational review article. It's titled The Placebo Effect, and it's from the Survey of Ophthalmology, published back in 1999.
Right, and what's remarkable about this piece, even though it's from '99, is that it doesn't just present its own findings. It meticulously references hundreds, literally hundreds, of studies and historical accounts. So it gives us this incredible panoramic view of how this concept has been understood, or maybe misunderstood, over centuries.
And crucially, we've also tapped into more recent research that actually cites this seminal work. So that allows us to see how these ideas have evolved, how they've been reinforced, or maybe even challenged over the last couple of decades.
It creates a really robust and multifaceted lens, I think, through which to view this often, well, let's face it, elusive phenomenon.
Absolutely. So our mission for you, our listener, is to take this seemingly niche concept and really unpack its profound implications. For individual healing, yes, but also for the broader landscape of patient care and, as we just touched on, maybe for the very foundation of medical science itself.
Be ready for some serious insights, perhaps some aha moments.
Because what you think you know about placebos, well, it might just be the tip of the iceberg, obscuring a much vaster, much more powerful force underneath.
Definitely.
Okay, so let's start right at the beginning then. When most of us hear that word placebo, our minds jump straight to the sugar pill, right? The inert substance, the thing that's not supposed to do anything active biologically. But where does the word itself even come from? And how did it get this rather limited reputation?
It's really interesting how deeply ingrained that sugar pill image is. And you're right, it speaks to maybe a fundamental misunderstanding of the term's origin and its broader meaning.
Okay.
So the word placebo actually originates from Latin. It means I shall please.
I shall please. Interesting.
Yeah. And from its earliest documented uses, particularly in a medical context, it carried this connotation of satisfying or, well, appeasing a patient. Historically, and in many ways this perception still hangs around, it's been regarded as a kind of deceptive therapy.
Deceptive how?
Well, essentially, it's seen as an inert or innocuous medicine, a substance with no specific pharmacological action given with the primary intent to satisfy a patient's need or maybe their desire for treatment.
Oh, okay.
It's designed to simulate medical therapy, go through the motions of providing care, but crucially, the definition hinges on it having no specific action against a particular target disease or pathological process.
So right from its linguistic root, there's this idea of appeasement, almost like a benign deception rather than a direct biological intervention.
That's a good way to put it. That's certainly how it was often viewed.
So if we talk about a placebo producing an effect, are we basically talking about a non-specific psychological effect? Meaning, If it does anything, there's no obvious, direct biological explanation for why it works in the way a drug targets a specific receptor or kills a specific pathogen.
Exactly.
It's more about the mind or the context than the actual chemical composition of the substance itself.
Precisely. And, in the context of rigorous scientific research, particularly when designing clinical trials for new drugs, this nonspecific effect is often, sometimes a bit pejoratively, referred to as therapeutic noise.
Noise, like something getting in the way.
Yeah, like something to be filtered out.
Mhm.
Researchers actively and quite painstakingly try to remove or at least factor out this noise in their clinical trials. The whole point of a placebo-controlled, double-blind study is to isolate the true, specific effect of the new drug.
To see if it works better than just nothing, or better than the expectation.
Exactly. To see if the active compound offers a benefit beyond what the patient's own expectations or the doctor's empathy or the ritual of treatment might generate on their own.
That perspective, while vital for proving a drug works, right?
Absolutely essential, yeah.
It sounds like it might lead us to miss the bigger picture, to miss the forest for the trees, maybe, regarding how powerful these nonspecific things actually are in real-world healing.
I think that's a real risk. It's almost as if by trying so rigorously to control for it, we inadvertently diminish its perceived significance in the actual day-to-day world of patient care.
Like trying to listen to one instrument in an orchestra by muting all the others.
Exactly. And you realize the overall sound, the symphony, loses something absolutely vital in the process.
That's a fascinating way to frame it. This therapeutic noise idea implies we see it as an obstacle, something to eliminate, almost an impurity in the scientific process. But our source material seems to argue that this very perspective fundamentally misrepresents the true nature and maybe even the potential of the placebo.
Absolutely. The article really emphasizes that placebos are poorly defined, not because they're inherently fuzzy or unmeasurable, but because they aren't properly understood within the broader, much richer context.
What kind of context?
The context of social symbols and all those intricate interpersonal factors that fundamentally surround the entire healing process. It's not simply about what's in the pill or what's done during a procedure.
It's about the whole ritual.
The ritual, the environment, the profound relationship between the patient and the healer, and the patient's own internal story, their narrative about their illness.
So this suggests it's not just about a pill or even a specific medical procedure, but the whole experience of care.
Yeah.
It's the white coat, maybe? The doctor's reassuring words, the feeling of being listened to, the belief that something is being done for you, the hope that comes with a new treatment. These are all part of the placebo effect in its broader sense, aren't they?
Indeed. And what's truly fascinating here, and I think often overlooked, is that the placebo effect isn't just limited to inert substances given in controlled trials, or even sham surgeries, which we'll get into.
Okay.
This isn't just a phenomenon for sugar pills given when, nothing else is deemed effective. The source explicitly states that it also profoundly influences the outcome of conventional therapies.
The conventional therapies, like real drugs.
Yes. Active, proven medications. This is such a critical point, and it really transforms our understanding. It means the placebo effect is always at play. It's a constant companion, even when you're taking a proven active medication like an antibiotic or a blood pressure pill.
Wow. So it's part of the very fabric of every single healing encounter, regardless of the active ingredients involved.
That's what the evidence suggests. The specific pharmacological action of a drug might be one layer of influence, but the placebo effect is another, often intertwined and potentially equally potent layer that contributes to the overall therapeutic outcome.
It's like a hidden current beneath the surface, always there, subtly shaping the flow.
That's a great analogy.
That is a huge shift in perspective. It means we can't just dismiss it as some kind of sideshow. It's actually central to every interaction. So if we step back and look at the vast tapestry of medical history, especially before modern evidence-based pharmacology came along, what was healing really like then? Was it, by our modern definition, largely a placebo phenomenon?
The article makes a truly powerful and maybe somewhat humbling statement on this. It describes medical therapy before the 20th century as essentially a history of the placebo phenomenon.
The entire history.
Pretty much, according to this view. Think about that for a moment. From antiquity, from the earliest recorded remedies, right up until the dawn of modern scientific medicine. Tens of thousands of drugs, herbal concoctions, rituals, remedies were used to treat human disease.
Okay.
Yet the vast majority of them, the source notes, only a very, very small proportion, actually survived rigorous scientific scrutiny to demonstrate any true, specific clinical effectiveness.
You mean even someone like Hippocrates, the father of medicine, the guy whose writings form the bedrock of Western medical ethics? The article states that his extensive writings contain no specific treatments of proved value.
That's what the analysis suggests, yeah.
That's genuinely surprising. Given his huge historical stature and the Hippocratic Oath doctors still take today, it really makes you question what healing actually meant back then and what patients were responding to.
It absolutely does, and it underscores a critical point. What it highlights is how much of what was considered therapeutic in those eras was, by today's strict scientific standards, based predominantly on belief. Belief, ritual, the inherent power of the therapeutic encounter itself, and also, importantly, the body's own remarkable capacity for self-repair, rather than on a proven, specific biological action of the remedies being given.
So patients might have felt better, maybe even gotten significantly better.
Oh, undoubtedly. They may indeed have experienced profound relief, recovery, or improvement, but it wasn't necessarily because of the inherent properties of the potion or powder they were given.
Is the context.
The context, the hope, the faith in the healer, the elaborate rituals surrounding the treatment, and again, the body's own natural ability to overcome illness, or at least its symptoms. This historical perspective really sets the stage for understanding just how deeply ingrained the placebo effect is in human health and healing.
Not just as some scientific curiosity for researchers.
Exactly, but as a fundamental perennial aspect of the human experience of illness and recovery. It suggests that healing is a far more holistic process than just targeted biological intervention.
So we have this long history where what we now call the placebo effect was perhaps the main engine of perceived healing, though it wasn't really quantified. How did we go from that ancient sort of ethereal understanding to actually measuring this elusive effect with some kind of scientific rigor? Who first put numbers to it?
Right, that's the crucial next step. The turning point, and it really was a seminal moment in the scientific understanding, came with Henry K. Beecher's 1955 article.
Beecher, 1955.
He didn't just speculate. He undertook a really rigorous review of 15 different controlled studies that had already been done. And these weren't just studies on one illness. They spanned a remarkably diverse range of disorders.
Like what?
Everything from severe angina pectoris, heart pain and debilitating headaches, right down to the common cold and even seasickness. A real mix.
And what did he find?
What he found was remarkable. Across these varied conditions, the placebo response rate ranged from 15% up to a really significant 58%.
58%.
58% in some cases, and the average effectiveness across all those studies was 35%. This was a statistical revelation at the time.
35%. That's not just a small margin of error, is it? That's a huge, significant number.
Absolutely.
It shows this isn't just anecdotal, some vague feeling people get better sometimes. It's a measurable, repeatable phenomenon that clearly warranted serious scientific attention. So what does this mean for specific diseases like the ones Beecher looked at? Congestive heart failure, depression, ulcers, angina.
It meant that subsequent placebo-controlled studies, specifically designed to test conditions like those, consistently confirmed that the placebo effect was indeed a real and powerful component of patient outcomes.
So it wasn't just a fluke in those early studies.
No. Now, the precise response rate to a placebo can, and definitely does, vary significantly depending on the specific illness being studied. For instance, conditions with a strong psychological component or very subjective symptoms like pain or anxiety might see higher rates.
Okay.
But these studies definitively demonstrated that something significant was happening within these patients that went well beyond the specific pharmacological action of any given drug they might have also received in the trial.
So for something like pain, where how you feel is the main issue.
Exactly. Where perception is highly subjective but profoundly real to the patient, a 35% response rate for a placebo is a substantial benchmark. Any active drug being developed for pain has to clearly overcome this inherent baseline improvement to prove its superiority.
It fundamentally indicates that the mind and body can generate genuine therapeutic outcomes even without a pharmacologically real drug.
Precisely. And this has profound implications for how we design treatments, how we conduct research, and ultimately how we approach patient care. It's a compelling argument for the brain's own internal pharmacy, if you will.
That 35% average is genuinely astonishing.
Yeah.
And it makes you wonder just how pervasive this effect truly is. We've talked about pills, internal psychological states, but here's where it gets really interesting and frankly quite counterintuitive for me.
Go on.
The article discusses surgery as a placebo.
Ah, yes.
How? How can a physical invasive intervention involving scalpels and sutures possibly be considered a placebo? That seems to fly in the face of everything we understand about surgical efficacy.
It is a truly shocking revelation when you first encounter it, isn't it? And it really forces a reevaluation of what we consider effective in medicine. But the historical evidence, as cited in the source, is quite compelling.
How so?
Well, the article explains that many surgeries throughout history, and astonishingly, perhaps even some still performed today, gained widespread therapeutic acceptance and became common practice without critical or objective evidence of their specific effectiveness.
Wait, without proof they actually worked.
Without the kind of rigorous proof we demand for drugs today. This is a crucial distinction from drugs. Unlike pharmaceuticals, which, in most modern regulatory environments have to go through rigorous randomized clinical trials and get specific government approval before they can be widely prescribed.
Right, the FDA process and so on.
Exactly. Surgical innovation has historically been able to proceed far more freely, often solely at a surgeon's discretion, based maybe on anecdotal success or a theoretical rationale. There just wasn't always the same level of intense scientific scrutiny applied to surgical procedures as there was to new medications.
So you're telling me we've had procedures widely adopted, performed on countless patients, often with significant risks and recovery times, that turned out to be no more effective than essentially a sham operation.
That's what the evidence suggests in some cases, yes.
A procedure where the patient goes through the trauma and risk of surgery,
Yeah.
but the intervention itself has no specific therapeutic action on the underlying disease.
Exactly. The history of modern surgery, the article states quite bluntly, is filled with examples of such operative procedures where the perceived benefit was largely, or maybe even entirely, due to the placebo effect.
Can you give an example?
Sure. One particularly insightful example cited is a study on the laparoscopic excision of endometriosis. That's a painful condition where tissue similar to the lining of the uterus grows outside it.
Okay.
Now, the study found that the surgery was indeed effective in reducing pain. However, it also revealed that it was associated with a 30% placebo response rate.
30% again.
Right. It means a significant portion of the observed improvement in pain and quality of life could be attributed not just to the physical removal of tissue, but to the placebo effect of undergoing the procedure itself. The hope, the belief, the ritual, the sense of something definitive being done.
Wow.
In fact, some meticulously controlled surgical trials using a sham surgery as a control, where they basically make incisions but don't perform the key part of the procedure.
They do that.
Ethically complex, but yes, it has been done in research settings, and some of those trials have concluded that the specific surgical intervention in question was not more efficacious than the placebo surgical treatment.
That just utterly underscores the immense power of belief, doesn't it? And expectation and the sheer psychological impact of undergoing a medical procedure, even one as profound as surgery.
It forces us to profoundly reconsider what truly drives healing in many contexts, and it challenges our assumptions about what constitutes a real medical intervention. It makes you wonder how many procedures have been adopted based more on belief than on provable efficacy.
That truly makes you pause and think. How our belief system, our expectations, the ritual surrounding a procedure, whether it's taking a pill or undergoing surgery, can contribute so significantly to healing. It's not just the intervention itself, but the entire context. And if surgery, a tangible physical act, can have such a strong placebo component, what about the person performing the treatment? Can the physician themselves, the doctor standing right there in front of you, be a placebo or at least a significant part of the placebo effect?
Oh, absolutely. The article states this very clearly and I think eloquently. It says healing often begins the moment a patient shares the burden of their illness with the doctor.
Just sharing it.
Just sharing it. There's a fundamental human empathetic element at play here that really transcends pharmacological agents or surgical techniques. The presence of a caring, compassionate, and importantly, confident physician can profoundly relieve a patient's anxiety, especially when an illness is at its most distressing, causing both physical and emotional stress.
It's the human connection, the sense of not being alone with your suffering.
That's a huge part of it.
So it's not just the medicine or the surgery that's dispensed, but the empathy, the trust, The human connection built in that doctor-patient relationship, that intangible feeling of being seen, being heard, and being cared for, that itself becomes a powerful therapeutic tool.
It seems so. It's really the art of medicine in its purest form, isn't it?
Yeah.
Precisely. Physicians, just by their very presence, their mannerisms, their active listening, their confidence, their interaction, they can embody a powerful placebo effect. The source draws an interesting and insightful distinction here.
What's that?
It says patients perceive illness, that's their subjective experience of symptoms, suffering, distress, how they feel.
Okay.
Physicians, on the other hand, typically perceive disease, that's the objective pathological manifestation, the biological deviation from a healthy state, what they diagnose.
Illness versus disease.
Right. The distinction is crucial for diagnosis and targeted treatment, obviously. But the shared human experience, that empathetic connection, is absolutely vital for the patient's overall healing.
So when a physician reassures a patient, expresses confidence in a treatment, or simply listens intently and validates their experience,
They are activating a powerful, often unconscious cascade. A cascade of hope, expectation, a sense of agency, perhaps, that can profoundly influence the patient's subjective experience of their condition. And, as we'll discuss, in some cases, even measurable physiological responses.
it truly is the art of medicine interacting with the science, a synergy that feels like it's often undervalued.
I think that's fair to say.
It's incredible to consider the historical power, the contextual power of the placebo. But how? How does our mind actually trigger a physical response from something inert, like a sugar pill? Is it just wishful thinking?
Yeah.
A trick of perception?
Yeah.
Or is there something more tangible happening at the biological level?
Right.
The idea that belief alone can trigger measurable biological changes seems almost magical, almost too good to be true sometimes.
That is truly the million-dollar question, isn't it? And surprisingly, the article notes there has been, historically at least, little systematic inquiry into its mechanisms of action, given its sheer ubiquity and demonstrated impact.
That's weird. It's so powerful, but we don't fully know how it works.
It's a bit of a paradox. We acknowledge its existence and power, but we're still largely figuring out how it operates beneath the surface.
Yeah.
However, one prominent explanation draws from classic behavioral theory, specifically from conditioned responses.
Conditioned responses.
Like Pavlov.
Exactly like Pavlov. The healing effect, in this view, can be a learned response, a kind of stimulus substitution based on our previous positive experiences with medications or therapeutic rituals.
So if I've always taken a pill when I'm sick and then I felt better afterwards, my body learns to associate the ritual of taking any pill, maybe the taste, the act of swallowing, the expectation, with the eventual feeling of getting better. It's like Pavlov's dogs, but instead of salivating at a bell, my body prepares for healing when I engage in a medical ritual. That's a very apt analogy, yes. The conditioned response mechanism suggests that the ritual, the clinical setting, the doctor's confidence, the very act of receiving care, these all become conditioned stimuli. They trigger a physiological response that was previously associated with an active, effective drug.
Okay, that makes some sense.
But that's only part of the story. Scientists have also been actively searching for more direct biologic explanations. They're looking for specific biochemical mediators that would literally translate a psychological stimulus, an expectation, a belief into a concrete biophysical event of healing within the body.
Like finding the actual chemicals involved.
Exactly. And initial reports, for instance, suggested that placebo analgesia, that's the relief of pain caused by a placebo,
Okay.
might actually be mediated by endogenous opiates in the central nervous system.
Wait, endogenous opiates? You mean our body's own natural pain-relieving chemicals? Like endorphins, things that are chemically similar to morphine.
Precisely those.
So the placebo effect isn't just about feeling better because you think you should. It's about the body literally producing its own medicine in response to a belief or expectation. That's revolutionary.
It was absolutely a groundbreaking finding because it shifts the understanding of the placebo from being just a mere psychological trick or a subjective feeling to a deeper, more tangible mind-body connection with measurable physiological outcomes.
It's biological.
It suggests a biological basis, yes. It suggests that the brain, through a complex pathways involving neurotransmitters and neurochemicals, can indeed orchestrate real physical changes, including the release of powerful pain-relieving compounds in response to the perception of treatment, or even just hope and expectation.
So this finding started to shift the placebo from just being a statistical nuisance in trials
Exactly, towards being seen as a legitimate physiological phenomenon, albeit one that's incredibly complex and still largely uncharted territory in terms of its full scope, its underlying neurobiology, and especially its potential therapeutic application. It really opens up an entirely new frontier in understanding how our minds can influence our bodies.
That's utterly fascinating, the idea that our own bodies can create these therapeutic substances. But despite these compelling insights into biochemical mechanisms, like the endorphins, not everyone buys into the idea that placebos have a real physiological effect on the disease itself, right?
That's correct.
What do the skeptics say? What's their main counterargument to the idea that placebos actively heal the underlying condition?
You're absolutely right. There's a strong and important skeptical viewpoint within the scientific and medical communities. These critics often argue that the placebo phenomenon is frequently an artifact.
An artifact, meaning?
Meaning it's better understood by other, more conventional and simpler explanations, rather than implying some direct active healing property of the inert substance itself. Now, they generally concede, and this is an important distinction they make, that there is considerable evidence that placebos can relieve pain, anxiety, and suffering.
So they agree it makes you feel better.
Yes, they agree it can impact subjective experience, but they rigorously contend that there is no substantial body of evidence to show that placebos alter disease in any way.
So if I understand correctly, they're saying it might alter the perception of illness, how you feel about your symptoms, your level of discomfort, your mood, but not the actual underlying disease itself. Like a placebo won't shrink a tumor or eradicate a bacterial infection or repair a damaged organ.
Correct.
It just changes how you experience having that disease.
That's the core of their argument. For many subjective outcomes, particularly those related to sensation or emotional state, like pain for the patient, perception as reality, right? If a placebo alleviates pain, the patient feels better, period, regardless of the precise mechanism.
Makes sense.
However, when there's a need for a measurable physiological response that directly impacts the disease process, like, as you said, tumor regression or a reduction in viral load, or the healing of tissue damage that you can actually see on a scan well, self-deception or mere perception becomes a less satisfactory explanation for the skeptics.
They want objective proof.
They look for objective, verifiable changes in disease markers, in the pathology itself, and they argue that these are rarely, if ever, directly caused by placebos alone. The key distinction they make is between symptomatic relief and actual disease modification.
Okay, that clarifies the skeptical position. Are there other explanations beyond just saying the placebo itself doesn't directly affect the disease for why people might seem to get better after taking one?
Yes, absolutely. Beyond the direct placebo effect derived from an inert substance, skeptics and, frankly, prudent researchers alike offer several alternative explanations for observed improvements that could easily be misinterpreted as a genuine placebo response. Well, one significant and frequently overlooked factor is simply the natural course of disease.
The idea that many diseases just get better on their own anyway, or they fluctuate in severity irrespective of any intervention. It's just the body's own resilience or maybe the cyclical nature of many chronic conditions.
Exactly that. The natural course of most diseases is rarely a straight line of continuous decline. It's often one of natural recovery or at least significant fluctuations in symptoms over time.
Right.
And think about it. Patients typically seek medical attention when their illness is at its peak severity, when they're feeling the absolute worst, or when their symptoms are most bothersome.
Makes sense. You go to the doctor when you feel awful.
And statistically, when something is at its absolute peak, whether it's a stock market high or peak symptom intensity, it has the highest probability of naturally receding or improving afterwards, simply due to statistical regression.
Regression to the mean.
Precisely. What statisticians call regressing to the mean. So if you measure a patient's symptoms at their absolute worst, any subsequent measurement, even without any intervention at all, is likely to show some improvement just by chance.
And that natural improvement could easily be mistaken for a treatment effect, whether from a real drug or a placebo.
Easily, and it often is. It's a powerful bias that researchers have to constantly account for in their study designs.
Okay, so natural history is one factor. What else?
Another crucial psychological aspect that contributes to perceived placebo effects is response expectancy and compliance with demand.
Compliance with demand. What does that mean?
Well, many patients are, understandably, deeply grateful for the care they receive. They often hold their doctors in high regard, and they frequently, perhaps unconsciously, want to please their doctors.
Oh, okay.
This desire can lead them to give undue weight to positive changes in their condition. They might focus on any small improvement and simultaneously downplay any negative sensations or lingering symptoms.
So they're almost unconsciously filtering their experience to present a more positive picture to their healthcare provider. Maybe to fulfill an unspoken expectation that they should be getting better.
Precisely. Or, alternatively, maybe in conjunction with this, patients might also feel consciously or unconsciously intimidated by their physicians, given the inherent power dynamic in the doctor-patient relationship. And therefore, they might feel motivated to confirm the doctor's expectations. This can lead to misleadingly positive self-reported feedback, where they report feeling better, partly because they believe that's what the doctor wants or expects to hear, rather than giving a completely accurate, unbiased reflection of their internal state.
That's a subtle but powerful dynamic.
It is, and it's something researchers must constantly strive to mitigate in how they collect patient-reported data.
Are there other biases?
Yes. Related to that is the concept of perceptual bias. The fact is, most observed placebo effects are primarily self-reported perceptual interpretations.
Meaning they can't be objectively measured.
Often, yes. They cannot be objectively documented or measured by external, independent means. This is why the greatest amount of research on the placebo phenomenon has traditionally been concentrated in areas where subjective experience is paramount.
Like pain relief, nausea, anxiety, psychiatry.
Exactly. When the outcome is based entirely on a patient's subjective perception on how they feel, it's inherently difficult to definitively prove or exclude the possibility of self-deception or maybe an unconscious reinterpretation of symptoms. If you expect to feel better, you might interpret ambiguous sensations as improvement.
Right. Yeah, you could easily convince yourself. This whole discussion reminds me, actually, of the misophonia citation we've seen in other contexts.
Ah, interesting connection. How so?
Well, with misophonia, individuals show heightened physiological responses like increased heart rate, skin conductance to specific sounds that don't bother other people at all. It highlights how a subjective experience, like hearing those trigger sounds, can have very real, measurable physiological components.
That's a perfect connection.
So the line between purely perception and a physical effect becomes incredibly blurry, doesn't it? When the body responds measurably to what originates as a mental or emotional state, It's clearly not just all in your head if your actual physiology is visibly reacting.
That's a vital point to emphasize. While the skeptics rigorously argue about whether placebos alter underlying disease pathology, the misophonia example, and indeed the research on endogenous opiates we talked about, powerfully demonstrates that even highly subjective perceptions can trigger autonomic arousal. They can activate specific neural pathways, and they can result in tangible, measurable physiological responses.
So for many conditions, especially those heavily influenced by the nervous system, by stress, anxiety, emotional states,
Yes.
where for the patient, perception is reality in terms of their suffering.
Absolutely.
The distinction between a purely real physical effect and a perceived one becomes increasingly complex, maybe even less relevant to the patient's actual experience of relief and well-being.
I think you could argue that. It certainly pushes the boundaries of how we define and measure effect in medicine. It urges us to consider the holistic experience of the patient much more seriously.
This deep dive is truly making me reevaluate the entire concept of the placebo, moving it so far beyond just a sugar pill. Given all this debate, the nuanced understanding we're developing, the very real physiological mechanisms that can be activated, why then does the FDA, the ultimate gatekeeper of drug approval in the U.S., put so much unwavering stock in placebo-controlled trials? It seems almost paradoxical if the effect itself is so contested and multifaceted.
It might seem paradoxical at first glance, but it's actually not. In fact, it's seen by many as the greater testament to the power of placebo.
How so?
The FDA's rigorous requirement for placebo-controlled trials isn't a dismissal of the placebo effect. Quite the opposite. It's a profound acknowledgement of its pervasive, powerful, and often unpredictable influence.
Okay, they demand it because it's powerful.
Exactly. Regulatory bodies understand that to truly prove a new drug's specific effectiveness, that it works better than doing nothing, or better than just the expectation of getting better, or better than the body's natural healing, you absolutely must control for the placebo effect.
You have to subtract it out, essentially.
You have to compare against it. Without that baseline comparison, without stripping away all those nonspecific factors that can contribute to patient improvement, you simply can't confidently attribute any observed improvement solely to the active compound in the new drug.
It's about scientific integrity.
Scientific integrity and patient safety. It's a cornerstone of modern drug development, designed specifically to isolate and measure the specific pharmacological action of a novel therapeutic agent.
That makes perfect sense for developing new drugs.
Mm.
But the article also makes this striking, almost alarming point, that the vast majority of therapeutic interventions used in clinical practice have not been rigorously tested for effectiveness, using these gold standard placebo-controlled trials. That's a huge, almost unsettling revelation, isn't it? We tend to assume everything a doctor does is firmly evidence-based, but this suggests a significant portion might not be, and we might be relying on something else entirely.
It is indeed a huge point, and it definitely challenges a core assumption that many patients, and perhaps even some practitioners, hold about modern medicine. While new drugs face this intense, multi-phase scrutiny that can take a decade or more.
Right.
Many established medical practices, particularly older procedures, surgical techniques, or even long-standing common treatments, have simply not been subjected to the same rigorous placebo-controlled trials.
Why not?
Often because they were adopted based on the prevailing medical theory of the time, or maybe compelling anecdotal success or expert consensus, long before such rigorous testing became the absolute norm, especially for procedures.
Can you give an example of that?
Sure. The article cites systemic antibiotics used for postoperative endophthalmitis. That's a serious and potentially sight-threatening eye infection that can happen after eye surgery. For a very long time, giving these powerful antibiotics systemically, like through an IV or pills, was standard of care, routinely prescribed post-surgery.
Seemed logical, right? Fight infection.
Seemed logical. However, more recent, more rigorous research eventually showed they didn't actually improve visual outcomes or prevent complications compared to just using local treatments like antibiotic eye drops directly in the eye.
So the systemic antibiotics weren't adding specific value.
Not in that specific context, according to the later evidence. This exemplifies how crucial rigorous testing, often involving placebo controls, really is, not just for brand new drugs, but for all medical practices, new and old, to ensure we're providing truly effective, specific care and not just relying on historical tradition or the generalized, non-specific benefits of attentive patient care.
It's a call for ongoing scrutiny across the board, really.
It really is.
Now, since our primary source is from an ophthalmology journal, the Survey of Ophthalmology, does the placebo effect play a unique or particularly insightful role within the field of eye care? Are there specific dynamics there that make it more pronounced or maybe more complicated?
It definitely provides a specific and often quite illustrative lens. The article highlights what it calls the dichotomy of the placebo.
Dichotomy.
Yeah, this inherent tension, as it says, with its origins interwoven with deceit and with healing. This inherent tension, the authors argue, makes its use, and even just the discussion of it, in ophthalmology complicated by how one personally defines a placebo and by one's individual ethical values. The authors note that the placebo effect in ophthalmology comes in many forms and disguises, and what's least recognized, they suggest, are the numerous and often subtle ways in which ophthalmologists simply encourage and support their patients through their illness.
So things like their comforting presence, reassuring words, the confidence they project, the whole ritual of an eye exam or a procedure.
Exactly, all those supportive elements.
So it's not just about potentially giving a patient, say, a saline solution and claiming it's a revolutionary new eye drop. It's also about the general caring presence, the emotional support, the confidence conveyed by the doctor.
That's a huge part of it, yes.
But does it also extend to therapies where the specific benefit might be questionable or unproven, yet patients report feeling better?
Exactly. While that compassionate aspect of care is undoubtedly a powerful form of the placebo effect, the importance and certainly the ethical complexity of the placebo effect becomes most critical, according to the article, for therapies of questionable benefit.
Like what?
The article specifically mentions certain supplemental vitamins or antioxidants that are widely marketed for various eye conditions. The implication is that for some of these, the perceived benefits reported by patients might largely be driven by the placebo effect, rather than a specific proven biological action of the supplement itself.
And that makes the ethical considerations even more pronounced, doesn't it?
It really does. How do you balance the potential for genuine patient benefit through the placebo effect, which often relies on some level of belief or expectation, with the absolute imperative for evidence-based medicine, especially when the specific efficacy of a treatment is uncertain or unproven?
It forces a difficult conversation about transparency and honesty.
Very difficult.
Which brings us squarely to the elephant in the room, the ethical considerations. If a doctor has this powerful tool, the placebo effect, at their disposal, is it truly ethical for them to intentionally use a placebo, maybe prescribe an inert substance, if they know it has no specific biological action against the disease? It feels like it could be a fundamental breach of trust, almost a direct lie to the patient.
This is indeed one of the most complex, most contentious, and most actively debated aspects of the placebo phenomenon in actual clinical practice. The article states that any discussion on the right or just use of placebos is complicated by lack of a uniform definition of placebo.
Right, because if it's not just the pill, where do you draw the line?
Exactly. And it's complicated, crucially, by the inability to definitively know the true reason for its use in any given situation. Is it genuinely to provide comfort and harness that mind-body connection? Or is it maybe to deceive for convenience, or perhaps even in rare cases for financial gain? However, despite those complexities, there is a very strong and general consensus among medical ethicists and professional organizations. Intentionally misleading patients about the effects of therapy is generally regarded as unethical.
And why is that?
The primary reason, as the source points out very clearly, is that it undermines trust in the doctor-patient relationship. And that trust is arguably the single most vital ingredient in any healing encounter. Without it, the entire foundation of care really crumbles.
And there's really no way to estimate how often physicians might intentionally, or maybe even unintentionally, leverage the placebo effect in ways that could be perceived as deceptive, even if they have genuinely good intentions.
It's impossible to know for sure.
This raises such an important, almost philosophical question. If it works, if a harmless placebo brings genuine relief to a patient and isn't harmful, maybe even avoids the side effects of an active drug, is it still wrong to prescribe it without full disclosure?
That's the crux of it.
Does the ethical imperative to always be completely truthful, even if telling that truth might diminish a patient's hope or their perceived improvement, does that always outweigh the potential for genuine patient benefit through what might be perceived as a lie or maybe just an omission? It's such a difficult tightrope to walk.
It's a profound dilemma, and there are many, many nuanced viewpoints. Some argue quite strongly that a doctor's primary duty is beneficence, the duty to do good for the patient. And if a placebo can genuinely help without causing harm, perhaps it fulfills that duty.
Okay.
Others argue just as strongly that patient autonomy, the fundamental right of patients to make informed decisions based on full, truthful information, must always take precedence, even if that truth potentially diminishes a therapeutic benefit.
Beneficence versus autonomy.
That tension is right at the heart of the ethical debate. Imagine a patient, maybe someone with chronic debilitating pain, for whom conventional treatments have failed or carry really significant side effects.
Right.
If a doctor genuinely believes a placebo could offer relief and it's benign, is it ethical to offer it without full disclosure, effectively saying this will help when they know it's technically inert?
Versus saying, look, this is a sugar pill, but strangely, some people find it helps anyway, which might completely undermine its potential effect.
Exactly. There's no easy answer. And it forces us to confront the true meaning of healing and the fundamental nature of the doctor-patient covenant. It's a conversation that medicine is still very much having and needs to continue having.
Where does this leave us? What's the overall conclusion from the source material about how medicine views and uses placebos?
Ultimately, the article concludes that allopathic medicine, that's conventional Western medicine, the system largely practiced today, rooted in specific treatments for specific diseases, has an ambivalent and often conflicting attitude toward the use of placebos in clinical practice.
Ambivalent and conflicting. Why?
Well, it's not just about a lack of clear-cut science or definitive mechanisms, although those certainly play a role. It stems from several factors, including the fundamental lack of agreement on exactly what constitutes placebo therapy, as we've discussed. If it's not just the pill, but the entire interaction, how do you even define its boundaries?
Right.
But perhaps most strikingly, the article highlights that physicians receive little or no formal training in placebo manipulation.
Wow.
Little or no formal training. Even though the same article explicitly calls the placebo effect the single most versatile therapeutic tool at their disposal, that's a truly striking contradiction, a profound disconnect, isn't it? It's like handing someone a powerful multi-purpose tool, but never actually teaching them how to use it safely or ethically or effectively. It is a profound paradox. And, you could argue, a significant oversight in much of medical education. On one hand, the placebo effect is acknowledged as being powerful enough that it necessitates rigorous control in multi-million-dollar drug trials. It often determines whether a new drug even makes it to market.
Yeah.
It's even described, as you said, as potentially the most versatile therapeutic tool available to clinicians for managing incredibly common subjective symptoms like pain, anxiety, fatigue. Yet the very people meant to wield these tools, the doctors, are generally not formally educated on how to understand, let alone harness, this inherent power ethically and effectively.
That gap in training. It's a stark reminder, as the article puts it, of how little real knowledge exists about mind-body interaction within the mainstream medical curriculum.
It really is. We have these incredible insights emerging about the brain's capacity to influence the body, about the power of context and expectation. But our medical education system is still largely rooted in a primarily biochemical, physiological model. It often sidelines the complex, profound, and frequently untapped interplay between mind, body, and the healing environment.
It underscores a fundamental blind spot, maybe, in our current understanding and application of truly comprehensive healthcare.
What if medical schools actually started teaching the art of therapeutic presence or ethical placebo utilization? It could potentially reshape patient outcomes in ways we haven't fully explored.
So we started this deep dive thinking of placebos as just sugar pills, right? Maybe a benign deception or just a statistical nuisance to be filtered out in studies, something that wasn't real medicine. But what we've actually seen is that the placebo effect represents this vast, powerful, and largely underexplored landscape of healing.
Absolutely. From ancient medical practices that were, let's face it, almost entirely based on belief, ritual, and the therapeutic relationship,
to modern surgical procedures where, incredibly, sham operations can produce very real benefits.
and even to the profound, measurable impact of a physician's compassionate presence. The placebo effect is clearly far, far more than just noise.
It's a powerful, multifaceted phenomenon that fundamentally challenges our understanding of illness, recovery, and the very nature of healing itself.
It involves these intricate, complex interactions between our expectations, our learned responses from past experiences, and even, as we saw, the body's own sophisticated biochemistry leading to the release of natural pain relievers and other physiological changes.
It reminds us really powerfully that patient improvement isn't always, maybe not even primarily, about the direct, specific action of a chemical compound or mechanical intervention.
So often it seems to be about the entire context of care. The profound human connection, the subtle cues given by the environment and the caregiver, and the incredible, often untapped power of that mind-body interaction.
It is, in essence, a fundamental, deeply ingrained, and arguably vastly underestimated aspect of human health and the whole healing process.
It truly is.
So here's the final thought to leave you with. If the placebo effect is truly one of the most versatile and underused therapeutic tools at a physician's disposal, and if its power lies so deeply in the mind-body connection and that crucial human element of care, what more could we as a society and maybe as a medical community learn to harness from this powerful, often misunderstood phenomenon? What might a future of medicine look like if we intentionally try to integrate these profound insights? If we train doctors to consciously, ethically, and responsibly leverage the power of context, expectation, and human connection, rather than just trying to screen them out in clinical trials.
It really makes you wonder, doesn't it? What deeper dimensions of healing are still out there, yet to be fully understood, embraced, and perhaps even explicitly taught, to truly unlock the body's own innate capacity for health and well-being.